You're listening to the uMentor Talk Show, now available on the Umoja app. I'm your host, Imran Ramsey, and on this weekly talk show, we invite professionals and teenagers to take us through their journeys and give us advice. And remember, if you have any questions for the panelists that you see here, you can always leave them in the live comments, and we'll get to them during the show. And another place you can leave questions before we start, we wanted to mention a bit about the Inspire platform, which is a question and answer platform for career advice in our Shia community. So, as a rising professional, you can ask for great advice from other professionals. And as a mentor, you can give advice to our community's future professionals. And so, if you want to use that platform, that is available for free, of course, via the Umoja app on Android and iOS. Now, we are able every week to share inspiring stories of professional students and community organizations only because of the generous support of viewers and listeners like you. So please consider supporting our show at umoja.org/donate or through the Umoja app's donate window. And every little bit of support goes a really long way in helping us bring more speakers on, opening career doors for our youth and connecting our communities. So thank you. We appreciate it. Now, today's speaker is Brother Amin Shehata. He's a student in public health and global policy at the University of Maryland, College Park. And he actually transferred from George Washington University midway through his second year. So we'll definitely talk more about that because that's a really unique aspect of his story. He's multicultural and he appreciates cosmopolitanism. And he hopes to improve the standard of living and quality of life for people all across the world with the skills he's acquired and is acquiring in his studies. And then also, as we'll talk about, he aspires to be a health practitioner in the future. So let's bring on, and I should also say we organized this show quickly at the last minute. So thank you so much to Brother Amin for coming on and helping us make it happen. So let's bring him on. Assalamu alaikum, Brother Amin. How are you? Thank you so much again.
Wa alaikum assalam wa rahmatullah. I'm doing fine. How about yourself?
I'm doing well, thank you. Now, so I think if we can first go into, I guess, your basic introduction. I know I read a little bit of your bio, but tell us a little bit more about yourself.
Sure. Um, so, as was mentioned, my name is Amin Shehata. I was born here in the United States, in DC actually.
Mm-hmm.
But almost immediately thereafter, my family immigrated to Egypt, and that's where I attended grade school and my whole high school career as well. And then I moved back once again here to pursue tertiary education and attend university. Um, so I'm 21. I'll be entering my final. I started my final year of undergraduate studies, pursuing public health and global poverty as the minor there. Um, and I'm honored to be on this platform. So thank you for having me.
No, thank you. Seriously, I mean, we threw this together starting on Wednesday, so thank you again. I feel like I want to maybe ask you a little bit more about your path so far in your university years. So you switched from George Washington to University of Maryland, and then you were also telling me in the pre-interview that you actually switched what you were studying. So could you talk a little bit more about why, like what were you studying before, and why did you actually make that decision to switch?
Yeah. So initially, I started out at George Washington University, um, pursuing international affairs, politics, Middle East studies, um, that mix over there. Um, but I soon realized that this would be better as a side gig or as a side hustle, um, rather than something I want to pursue in the future. Um, Especially since I had lived in the Middle East. I had traveled in the Middle East extensively, and therefore pursuing Middle East studies wouldn't be a very ambitious sort of goal for myself. And so I told myself, politics, civic engagement, you can always do that on the side, and you can invest as much in it as you would like. Um, but I always wanted to assist people directly, and I thought the health sciences would be the best medium for me to do that. Um, so after 1.5 years at George Washington University, I transferred to the University of Maryland, um, just to dip my toes in a different environment and explore what this state institution has to offer. And thereafter, I declared public health um, as my major and global poverty as the minor. Um, and I might even add development, international development, as the second minor. And they're all interconnected and interwoven with each other. And I'd be happy to speak more on why I selected these areas of study.
Yeah, definitely. But I want to go a little more into the transfer process first, because I feel like you're being really humble with, like, when you said, you just wanted to like dip your toes into a new environment. At least what I've heard is the transfer process is, like pretty involved. So, uh, kudos to you for, actually going through it, realizing that that's something that you wanted to do. Could you talk about some advice for, I guess, realizing that maybe an institution is not for you, or a course of study is not for you, and then actually having the courage to go ahead and transfer out of it? I know it's a loaded question, but you can, just any piece of advice you think was helpful for you in navigating like that process.
Yeah. Um, so my reasons for departing GW were multifaceted. Um, I felt as if the atmosphere there wasn't conducive for myself, my personality, essentially. Um, it is a private institution,
Hmm.
heavily funded by different donors, um, and obviously donations come with strings. Um, and so I felt as if the university had a specific agenda that it was trying not to deviate too much from. Um, uh, there were a lot of clubs on campus, great diversity on campus. However, I wasn't able to gain much traction with the clubs. Um, Perhaps that was a shortcoming on my end. Um, However, I thought I would give myself a new beginning um, at another institution where I would be more committed and starting off fresh um, basically like a blank check. And so I thought UMD is a premier public institution. So and obviously I'm a resident in the state, so that was naturally an option for me. Um, and the basically the disparity in the tuition costs is dramatic. And so I transferred mid-year since I didn't want to wait any longer. Um, Time was of the essence in that regard. Um, the transfer process, what I would say about that is it is relatively involved. However, when universities and colleges see that you have courses and credits under your belt, it's oftentimes much easier to get yourself into maybe your dream college, your dream school, once you've attended maybe an institution that isn't at that tier. Um, and so, uh, I was accepted, alhamdulillah, into UMD, seeing that I had 1.5 years at GW. Um, and um, yeah, that was essentially it.
Hmm.
Uh, yeah, I wanted a fresh start with this new major,
Right.
and so I thought I could do it at a new university as well.
Hmm. Yeah, well, thank you for those tips. Now, let's talk about the major that you are in right now. So it's the major is public health. So for our viewers who might not really know what that is, what is public health?
Yeah, so that's getting at the heart of the matter.
Yeah.
So yeah, if I were to provide a definition for it off the top of my head, I would say um, it's a sister it's a sister science to medicine or to the health sciences. Um, it essentially revolves itself around the community. So it aspires to um, prevent diseases and illnesses and ailments in the community, but also to promote health within the community. Um, so oftentimes you might see medicine and um, doctors contrasted with public health in the sense that doctors seek to cure and treat illnesses um, after they already set in. Um, but public health attempts to prevent and equip the health system with institutions and um, institutions that prevents illnesses from occurring in the first place, which saves a lot of money. It's very
Hmm.
cost effective, but also it saves lives in that sense. So it's more preventative than curative, and that's what really um, made me enjoy the major
Hmm.
and admire the major, since a lot of the Eastern traditions focus on preventative medicine, um, but a lot of Western societies, and I'm generalizing here, but they invest heavily in curing um,
Yeah,
illnesses
right.
and diseases. So yeah, that's what stood out for me in public health.
And also, uh, we should perhaps mention that public health also has more of a population level focus. I think that was one other thing you had said in the pre-interview. And why do you think it's so important to focus on um, not only preventing diseases before they occur, but doing it on a population level? Um, Along with, of course, we need doctors, along with, and on an individual level. Like, why do you think? Because public health has frequently been neglected. Um, it only gets like 3% of the federal budget. So why is it so important to focus on public health?
Yeah, yeah, you were exactly right on point when you said that it's often neglected, it's
Yeah,
relegated to the backdrop of society, um,
right.
and it's given secondary attention. Um, in my view, in my humble viewpoint, uh, public health is of paramount importance because, um, as you said, it addresses population level um, concerns and issues, um, and it focuses on the social determinants of health, which turn out to be the most critical variables in determining a person's health status, right? So, actually, the factor that's most significant in determining the health of a community is the socioeconomic status of the community. So, oftentimes, based on a person's uh, residence in a specific county or zip code, you can fairly certainly ascertain or determine what their health level might be, even what their life expectancy might be, what their estimated life expectancy
Right.
might. So really focusing on the environment of people, their social mobility, and their economic status, and trying to improve those, sanitation, clean water, all these issues come up when you focus and emphasize the social determinants of health rather than really zooming in on the individual and their health, um, and their individual behaviors as well. So obviously, it needs more funding and it needs, I guess, more appreciation from the public as well.
Yeah. Correction. Actually, I had said it gets 3% of the federal budget. It actually gets 3% of federal health spending. So even much less than 3% of the federal budget. But anyways, what are some careers that you would be looking into with a degree in public health? Or, you can even answer more generally, what are some careers that a degree in public health can lead to? Because I feel like public health is perhaps like a new field for many of our listeners.
Yeah. So public health has become ever so in demand. Ever since the onset of the pandemic, um, and the coronavirus. Um,
Mm-hmm.
um, However, the positive thing about public health is that it subsumes underneath it lots of different disciplines and topic areas. Um, as I mentioned, economics, environmental sciences, right, um, epidemiology, toxicology, um, and so the great thing about, in my view, the great thing about public health is it attracts a wide array of people who have diverse interests, um, but their mission is to obviously improve the health of the public. Um, and so, with a degree in public health, essentially you can obtain hard skills that can be useful, um, and skills that are transferable to a lot of different fields, a lot of different jobs. Um,
What
and
would some what are some of those skills? If you could, maybe list a few.
Mhm. Sure. So, um, I mean, by way of example, you learn different data techniques
Mm-hmm.
in epidemiology, to track or to quantify the perhaps the prevalence and incidence of disease in a community. So you utilize a lot of data, lots of computer languages, coding, etc. Um, so lots of different things are utilized
Right.
in public health, and they're all
Mm-hmm.
used to serve the public and to enhance the lives of the community members. Um, and so, as I mentioned, with public health, you can you're well prepared for medical school, in a sense, if you aspire to pursue that. Um,
Mm-hmm.
Lots of the requirements for public health um, mimic the requirements that perhaps somebody studying biology would take. Um,
Right.
with that, you can also enter the social sciences, um, and by the same token, you can also um, go to law school, and
Mm-hmm.
so it basically leaves your options open. And that's for someone like myself who was undecided or who was constantly trying to navigate what their aspirations are. I think public health is a good option. Um, and A lot of folks in
Yeah.
public health also tend to
Right.
pursue a master's, and
Mm-hmm.
then
An MPH, right?
right, and thereafter they're easily able to obtain an occupation and a job.
Hmm. Okay. Yeah. I think that was a very, very comprehensive introduction. So thank you for that. Now, going back to talking about your path specifically, you were mentioning that you have interests at the intersection of both economics and public health, which is partly why you're studying global poverty along with public health. So could you maybe go into a bit more what issues lie at that intersection, and how do they speak to you specifically, that drove you to study something economics related
Yeah,
along with public health?
yeah. So I hinted at this briefly already, in that the social determinants of health. One of them is the socioeconomic status. Um, so we tend to see a lot of minorities in the country with worse health outcomes than the majority, and you know um, this directly correlates or is directly associated with their income, um, in certain aspects and in certain respects. Um, and this is a disparity that is completely avoidable and one that is objectively unfair, unequal, and it really further bolsters the inequity that is prevalent in the country.
Mm-hmm.
And so that was uh, my main passion, I guess, is to reduce these health disparities, um, on a global level, especially. My main focus is not domestic, um, but on a global level. the the wide differences in life expectancy between countries in the global south, the less developed countries, um, as compared to some of the Western or European or Eastern Asian countries. Um, and as I mentioned in the bio as well, um, I would like to improve the standard of living for folks in the global south.
Hmm.
So that is to ensure that they have access to um, clean water, um, the necessary institutions that uh, can help prevent disease. So focusing on primary prevention of disease, malnutrition, avoiding all these things, and a lot of these things
Right.
fall under economics, global poverty, um, since economics can help tackle um, the underlying institutional issues that exist, um, and they seek to address the barriers that are in place on a governmental and institutional level that might be sort of hamstringing the progress of the country economically and health wise. Yeah.
Yes, those are such important points. I feel like uh, the primary, I don't know if you agree with this, but the primary factor that influences whether an intervention, a public health intervention, will be successful is um, if it makes economic sense. Because, like, for example, the vaccine rollout, we saw that that had all so much economic force behind it because, when someone gets their two shots, not only can they breathe a little bit easier, but they can also go back to normal economic life. So there is such an economic incentive to get that done, so much more than with interventions that would like improve equity, but perhaps not contribute as much to economic growth. But that's another topic for another show, maybe. But what are you looking to pursue after you graduate? I know you said you're leaving your options open, but you do have that goal that you just were talking about to make that overall impact. So, what are some paths that you think might help you get there?
Um, yeah. So um, I aspire to essentially, perhaps work in a global health institution or a health agency. The quintessential example of this is the World Health Organization. They focus on the global issues, that the health issues um, that cross borders and are not restricted to
Mm-hmm.
certain boundaries. Um, Also, development banks also seek to address issues that are hindering the progress of nations. Um, and so working in one of these agencies would be great. But at the same time, I want to incorporate the health aspect and the economic aspect. Um, and I believe these global institutions, these global governance institutions, have the capacity and um, the necessary amenities to be able to dispense the services that they need, um, and to fulfill the objectives that they have. Um, and at the same time, something like Doctors Without Borders, which is composed of doctors who roam the planet and use their skills um, to the benefit of the underserved and the underprivileged and the downtrodden. Um, Now there are some issues with, I mean, Doctors Without Borders. Um,
Mm-hmm.
but in the Shia community, there is I believe the name is I forget the name right now, but it's not Imana. It's
Imamia.
yeah, exactly. Imamiya Medics
Yeah.
International.
Mm-hmm.
They similarly have a similar mission and vision in the world. They're health professionals do pro bono work. Um, outside their main day 9 to 5 job. Um, and so something like that is something that would be something I aspire to do.
Hmm.
Yeah.
Yeah. Yeah. That's a very noble, I think, goal to pursue. And this is something we didn't talk about in the pre-interview, but I feel like it fits pretty well here, which is how do you think your Shia faith motivates you to want to have that kind of altruistic impact in any way? I mean, it could be in what you're studying, could be in the career that you might pursue, um, but how has it driven you so far? And what do you think? How do you think it'll drive you in the future?
Yeah. So that's obviously an excellent question. Um, Firstly, I guess faith inspires me to adhere to certain principles and morals and ethics that really undergird anything I might study in class.
Yeah.
Uh, I try to compare what I'm studying in class to some of my principles and ethics, and oftentimes you'll find that they align, um, yeah, at least superficially. Um, for example, I've been led to believe that everyone should have access to healthcare. It is a human right, um, and nobody should be denied, uh, you know, um, coverage or access to
Mm-hmm.
life-saving treatment or medicine or medication or anything they need. Um, and so this really harkens back to the idea of equity and reforming the healthcare system that we have currently, which um, is leading us into a trajectory that is unsustainable. Right?
Right.
Uh, we have um, ever increasing costs, and lower quality of care for patients, and access to care is not universal. There's no universal coverage in the United States.
Mm-hmm.
So even reforming our healthcare system to mimic or at least um, adapt some of the positive elements of other healthcare systems, perhaps in Europe or in the UK, to better the healthcare system here. Um, and another way that I guess Shia faith um, has really inspired me is in wanting to prioritize service above self.
Mm-hmm.
Uh, Serving others. Uh, so going out of your way to see what the needs of others are, um, without them having to directly tell you what they are.
Right.
And uh, so yeah, I'm
Yeah.
currently interning at an institution that provides support, understanding, and opportunities for people with intellectual and developmental disabilities. So we're trying to ensure that the folks um, we're trying to ensure folks are eligible to apply for federal programs that will give them access to healthcare, such as Medicare, Medicaid, um, and other governmental assistance programs, food stamps, and temporary assistance for the needy. Um,
Mm-hmm.
so I guess it's a great launching pad, I guess, for
Yeah.
future opportunities. Yeah.
Of course. Yes. Um, so unfortunately, we are almost out of time. Again, 30 minutes went very quickly. But there is one final question that we ask all our panelists to share with us, which is what is your final piece of advice for our listeners if they maybe didn't take anything else away from this show, which I hope is not true, but if they didn't take anything else away, what is the one thing that you would want them to uh, remember after hearing the show?
Yeah. So I guess
I
that's the
know.
most
Sorry for putting you on the spot, but
yeah, that's the most profound question and the most important question, I guess.
mm,
Um, because if the audience wants to glean anything from this, it should be key takeaways that they can, practical takeaways that they can use in life. But I guess I would say, um, try and um, combine your academic passion, your passion for different fields of study, or different areas of study, with the, I guess, the Islamic need in society. So if you're able to identify um, what is some blemishes in society that need to be reformed, see how your field and your passion can be used to fill that void, or to fill that gap. That way, you'll be advancing yourself academically, uh, but also, I guess, religiously and spiritually. You'll be propelling yourself forward, because um, you're pursuing your academics, but you're also serving humanity, um, which I guess is one of the ultimate goals um, of religion and of ethics. Um, so really, uh, I guess focus on what you're passionate about, since uh, when you focus on what you're passionate about, that puts perfection in your work. Um, so I guess don't pursue majors that might fall beyond what you're interested in, because then you might burn out, right? You
Mm,
might be
right.
able to pursue it for a couple of years, but
Mm-hmm.
down the line, down the line, it won't be sustainable for you. It might lead to, to miserable outcomes. Um, so yeah, I guess follow your heart in that sense, because then you'll be able to excel academically, um, and I guess that's what's most important.
Yeah. Okay. Thank you so much for all your advice and sharing your story, and also making time for coming on the show. Thank you.
Thank you very much.
Of course. And thank you, everyone, for tuning in to the uMentor Talk Show. Tune in to our show next week, Saturday at 3 p.m. We are having another show, and it's going to be a community voice show. So that's the one where we interview community organizations, and it's going to be with Faraj Mental Health with Sister Harim Jaffrey. Also, if you enjoyed the show today, please consider supporting the uMentor Talk Show to help us continue our work at umojaoutreach.org/donate, or through the Umoja app. And as I said at the beginning, every little bit goes a long way in opening career doors for our youth, bringing in more speakers, and connecting our community. So thank you for that. Remember, you can always catch our previous episodes on YouTube, SoundCloud, Spotify, Apple Podcasts, and in the Umoja app, and on our website. So that's a lot of places that you can look. Umoja Outreach Foundation, uniting and empowering the Shia community.